I am presenting here a scoping review we have performed to try and understand the current evidence base regarding the interplay between lower urinary tract symptoms and heart failure. I have no affiliations to disclose. We know that the prevalence of heart failure is increasing, and we also know that lower urinary tract symptoms, or LUTS, including urgency, frequency and nocturia, are highly prevalent, particularly in older adults. Current guidelines, as well as custom and practice, suggest assessment and treatment of heart failure in older adults with LUTS, but the evidence behind this recommendation is sparse. We therefore want to just summarise the existing evidence to guide evidence-based clinical practice and identify the gaps for future research. To do this, we chose to perform a scoping review of the literature based on the methodology of Arksey and O'Malley, rather than a systematic review or meta-analysis, as our preliminary search showed a clear lack of rigorous clinical trials. We performed our search using the search terms you can see here, as well as a grey literature search to identify any further articles. We used the inclusion and exclusion criteria as outlined here as well. Once we'd narrowed down the final articles, we extracted the data and key findings, which allowed us to sort the evidence into key themes. This flowchart shows our search process, with 2,831 citations identified and 35 included in the final scoping review. Of these 35, 24 were original articles and 11 were review papers. From these 35 relevant articles, 7 key themes were identified, as you can see here. The first theme was the epidemiology of LUTS in heart failure. We found only 2 epidemiological studies which estimated the prevalence of all LUTS in patients with heart failure. A further 16 articles reported the prevalence of specific LUTS, predominantly focusing on incontinence and nocturia. The prevalence varied significantly depending on the study, which is likely to reflect both the small scale and poor methodology of many of the studies, as well as the differences in definition of each of the different LUTS used by the different studies. The second key area we identified was causes of LUTS in heart failure, but the studies aiming to establish a link were either purely speculative or correlative, and so do not provide convincing evidence as to mechanism or causality. It's important to note, however, that as this was a scoping review, we did not formally review the quality of the articles included. We also reviewed the impact of sex, medications and severity of heart failure on the LUTS experienced by patients who have heart failure. We found 6 studies that reviewed the impact of sex on LUTS in heart failure, with these coming to differing conclusions as to the impact. A number of the studies looked at the impact of medication on LUTS in heart failure, with the majority focusing on diuretics. Again, the differing studies came to differing conclusions as to whether there is any impact of taking diuretics on LUTS symptoms, with 3 finding no link between diuretics and LUTS, and 4 reporting correlation between certain LUTS and taking diuretics. Again, however, none of the studies seemed to be of adequate quality to draw significant conclusions or to advise altering clinical practice. There was a general impression that LUTS are more severe in patients with more severe heart failure, but again, this was not consistent across the studies. Another key theme that came up was the impact of nocturia for patients with heart failure. Many of the studies suggest that nocturia may be contributing to the significant lethargy experienced by patients with heart failure, and therefore is important that this is addressed. The final key theme we looked at was whether the literature provides any guidance regarding specific management options for the LUTS experienced by patients with heart failure. Again, the majority of the studies we identified were epidemiological in nature, with very few investigating particular management strategies to manage or reduce the LUTS, and there have been no RCTs to date. So it's very clear from this study that the evidence is extremely patchy, making it difficult to draw robust clinical conclusions. The paucity of data and the potential role of LUTS in discouraging concordance of patients with their heart failure treatments makes this a really important area for future research, particularly as the studies give the impression that these symptoms are relatively common. So to conclude, clinical experience and practice suggest that heart failure and lower urinary tract symptoms interact with a bidirectional relationship. It's important this is appreciated by both continence specialists managing patients with heart failure, as well as heart failure specialists whose patients may well have LUTS. At the moment, there is no good evidence to explain this interaction, to explain its extent, or the optimal management strategies of these urinary symptoms in patients with heart failure, and vice versa. Despite this lack of data, health professionals interacting with patients with heart failure should be aware of the potential implications of the diagnosis and treatment options on urinary symptoms, as this may well impact on quality of life as well as medication compliance.